roto-rooter of the arteries, but they help cleanse the arteries. So what about oxidized LDLs? As I said, they're the ones that really we have to be concerned about. More and more physicians I see, more and more cardiologists I see, are actually starting to measure oxidized LDL levels in patients' blood in their laboratory testing, which again is, I think, more indicative of not only the amount of inflammation that may be present in their blood vessels, but how to better approach controlling LDLs and HDLs. As I said, oxidized LDLs injure the endothelial cells that cause inflammation. And if you look at a blood vessel, this drawing that I made, if you take a look at a blood vessel, or I took an artery out of your heart, there are 3 different layers of muscle around the blood vessel itself. The inner lining of the blood vessel is basically made up of a series of cells called endothelial cells, a real thin layer of cells. And those actually are the cells that cause inflammation that can contribute to plaquing in our blood vessels. Oxidized LDLs actually cause this endothelium to become inflamed. And if you've had back problems, you've had joint problems, one of the chronic or classic signs of inflammation is the area wants to swell up, it gets red, it gets hot. So if you had a blood vessel that was inflamed, instead of the blood vessel being a certain size, it's going to be smaller, or the opening will be smaller, just simply because it's so inflamed. And when it becomes inflamed like that, there's less blood flow through that. And if you couple that with high blood pressure problems, and high blood pressure is one of the major causes of inflammation in our blood vessels, because the pressure is so high, it causes more inflammation. And as you get more inflammation, there's more chance of plaquing to take place, more chance of fat being deposited in the blood vessels, and an increased chance of those blood vessels getting smaller and smaller and smaller until finally they're occluded, to the point where there is no blood flow. You have a heart attack. So these endothelial cells, again, become inflamed. The next couple of points, basically there's a series of inflammatory reactions that take place in these blood vessels that trigger that inflammatory response and contribute to plaquing. It also triggers an immune response. And anytime we have a foreign invader in our body, our immune system automatically attacks that. And what happens because of the inflammation changes that take place in the endothelium, the body looks at that sometimes almost as a foreign invader. So because of that, it attacks itself, causing more inflammation and can cause more plaquing, and can even cause a fibrous plaque or scar type tissue to form inside the blood vessel. The other important thing that we notice when the endothelium becomes inflamed is that nitric oxide, which is a chemical that's produced by the linings of the blood vessel, becomes produced in lesser and lesser quantities. Nitric oxide is important because nitric oxide is produced by our body to dilate blood vessels, to help control blood pressure. And when these nitric oxide levels are suppressed, we notice that the blood vessels don't want to be as elastic or flexible, they don't dilate as much, and we have vascular problems. And again, not just in the heart. We see it in a lot of patients we treat with diabetes problems that have diabetic ulcers, that have venous stasis ulcers. They don't produce and are not producing enough nitric oxide. So there's another significant problem. There have been approximately, I think, 7,000 studies done over the past 10 or 15 years on nitric oxide and how important it is in the protection of not just the heart, but protection of the entire blood vascular system. But it can, as I said, lead to many vascular diseases all over the body. So what I want to think about is, think about this. So if we have oxidized LDLs, plus we have inflammation, that's the perfect recipe for atherosclerosis or arteriosclerosis, or plaquing in the blood vessels. So how do we prevent the LDL oxidation? How do we reduce inflammation? As we talked about last week and the week before, diet has a lot to do with all of it. Eating dark green leafy vegetables are extremely important, whether it's spinach or collard greens or kale, mustard greens, all important. Eating colorful foods, whether it's fruits or vegetables, are extremely important. An anti-inflammatory diet, which I don't think you have right now, and I'll get you that before you leave, is basically just a listing of foods that reduce inflammation. But so it not only reduces inflammation in the blood vessels, it also reduces inflammation in your joints, inflammation in your liver, inflammation in your stomach, in your large intestine, so your body can function better. But we'll get you a copy of that before you leave. There are supplements. Patients ask oftentimes about, well, what supplements can I take to help reduce this? Coenzyme Q10 is one. Vitamin E is important to reduce inflammation when taken with CoQ10. Lycopene, which is the stuff that's in tomatoes, It's a powerful antioxidant. Pomegranate is excellent to reduce LDL oxidation because all these foods act like antioxidants. There are a variety of different herbs. Omega-3 fish oil is extremely valuable in terms of reducing inflammation. Another substance called polycosanol, which we'll talk about in a second, is really, really beneficial in reducing inflammation and oxidation of the LDLs, but so is the vitamin B3 niacin. So here's what I would hypothesize. So if we can reduce oxidation of the LDLs, we can reduce inflammation that contributes to atherosclerosis, can we, without medication, reduce cholesterol, decrease LDL, and increase HDLs? And the answer to that, simply is yes. I find it very puzzling, just in my day-to-day practice and in some of the patients I treat with nutritional therapies, how many patients are taking statin drugs, and no one has ever really talked to them about how they can alter their diet or take some nutritional supplements and actually lower their cholesterol as well as their LDL levels, without having to take medications. Some of the risk factors, for oxidation of LDLs or high cholesterol, one is weight. Any extra weight you have, you increase the amount of oxidation in your body just in general. As we mentioned briefly, eat good foods, fruits and vegetables. Nuts are good. Eating meats, and meat's not a bad thing necessarily to eat. As long as if you're eating red meat, you eat lean red meat, not real fatty red meat. Chicken, fish. If you're eating chicken, it's important not to eat the skin or even eat the fat because a lot of toxins build up in the fats, of chicken especially, as well as the antibiotics and steroids and everything else that they use to grow chickens more quickly. Unless of course you can buy free-range chickens, but I still would not recommend eating a lot of skin or fat from chicken. There are good fats that you can eat. The monounsaturated fats, like extra virgin olive oil or coconut oil, excellent choices. And they are very anti-inflammatory. They reduce oxidation of LDLs. And again, are just very, very healthy oils to eat. And extremely important if you want to control cholesterol levels. Omega-3 fish oils, probably if there's no other supplements you ever took, I would recommend you take omega-3 fish oils because it has so many positive effects on how your body functions, from helping control blood sugar level, to helping control blood fat level, to helping increase circulation throughout your body, but also helps with your brain function. So you can take 1,000 to 3,000 milligrams a day or eat a couple servings of fish a week, but even that you've got to be careful about because there's so many toxins in the fishes that we eat. Whether they're dioxins or they're PCBs or mercury or even lead in some fish. Some examples of some omega-3 fishes that are good are cold water salmon, mackerel, sardines, and really just any of the oily fishes are good. And then don't eat the bad fat. And really to know the bad fats, the trans fats, the hydrogenated fat, and the partially hydrogenated fats, you need to read labels. These fats in our body are very stiff versus some of the other good fats that are very soft and pliable. One thing interesting about our heart, it's a little different than the rest of our body. Our body runs primarily on sugar for energy. That's its primary source of energy. So when you eat a carbohydrate like eat a banana or you eat an orange, it's converted to sugar in our body, and our body utilizes the sugars in our bloodstream for energy. But our heart, even though it does use sugar for energy, it also uses fat as a major source of energy. So as you ingest fats, fats are almost immediately absorbed into your bloodstream, sent to your heart for energy. So if you're eating the good fats, those are the fats you want to have into your heart. The bad fats can cause inflammation. They can nick the blood vessel walls because they're very stiff, they're very hard. And those are the types of fats that you might find in peanut butter or margarines or anything that would take a soft oil and make it firm and make it solid at room temperature. But if you read labels, you'd be surprised how much trans and hydrogenated fat you might be eating.
Is butter better than margarine?
Butter's better than margarine.
Good, because I don't use margarine.
Good. I wouldn't either. I think butter's a better choice. Saturated fat, which is what butter's always had a bad rap because of saturated fat. Well, the New England Journal of Medicine about, 3 or 6 months ago, published an article about saturated fat and found that saturated fat is not as bad for us as we always had thought. Most of the studies that were done with fats over the past, since 1972, really, over the last 30 plus